Today, we're going to talk about the vital signs your doctors forgot to tell you about. I was looking up a couple different things on what I wanted to talk about today. And again, I want to provide valuable information to you guys. And there's talk in the physical therapy community about, these vital signs. Hi, Elaine. How are you? So if we talk about the vital signs that your doctor forgot to tell you about, there's two that come to mind, and they're very, very, very simple. The first one is walking speed, and I'm going to put some links to some articles that are kind of nerdy, but that's my jam, that have to do with how walking speed correlates with quality of life, not just in older adults, but in other populations, people who have had strokes in the past, people with like Parkinson's disease, people with other potential comorbidities, right? And how their walking speed correlates with the quality of life that they have. So walking speed is the first vital sign that your doctor forgot to tell you about, right? We have all these other ones: temperature, blood pressure, heart rate. But we don't ever test walking speed in the medical community because it's, you can't just hook somebody up to a machine and it tells you what it is, right? You have to, well, I guess you could put them on a treadmill. And every medical doctor or every office has a treadmill, right? So walking speed is the first one. So that kind of ties in with last week's video of the best exercise we can do, especially as we get older, is walk. Then the next best exercise is walk fast, right? To far oversimplify something that's complicated, walk and then walk fast, right? Your quality of life improves, especially as you get older, the faster you can walk. And they use crossing the street safely as the measure there. So if you feel like you could cross the street safely, good, keep walking fast. If you don't feel like you could cross the street safely, start adding in a little bit. You don't have to walk fast for long, but start adding in 15 feet of fast walking or 10 seconds of fast walking to the walks that you're doing throughout the day. It's a really simple hack, but it will go a long way in as far as the quality of life and the strength and the stamina that you have. That is the first one. The second one, and it seems too simple to work, right? How could this be a thing, Cal? Getting up off the ground. I harp on it with my patients, with my athletes, with my students. Getting up off the ground. Let's think about it for a couple reasons. The first reason is, heaven forbid you should fall, and there's no furniture around, and there's nobody around to help you up. You need to be able to get up off the ground by yourself, especially if something got hurt during the fall, right? You hurt a knee, a hip, a shoulder, a neck, anything like that. You need to have strategies to get up off the ground. The second is that it's a really good indicator of all of the mobility and all of the strength in your feet, your ankles, your knees, your hips, your low back, your upper back, your neck, and your shoulders. 8 spots, right, that we can look at and assess without fancy equipment or anything like that. So, a self-test. There's actually 2 self-tests that I want you guys to do today, at some point today. The first is one of my favorites. You get on the ground, and I'm going to put the reference to this article. I can't seem to find it right now. I have the book that references it. But the first is you are going to get on the ground and sit crisscross applesauce style. Okay? Like this, up as tall as you can get. Okay? From here, here. Okay. Up as tall as you can be, and just sit. Okay? Some people's knees are going to be way up here. Some people's feet are going to be way out here. That is fine. Get as close to this kind of kindergarten sitting position as you can. Those of you who have grandkids, do this with them. Put them on a video chat and say, you guys get on the ground, grandma's going to get on the ground, and we're going to get up together. They will have a really easy time doing it. You will probably have a little bit more difficult time, and that is okay. But that happens because of age, we don't do it. We stop doing it, right? We get into our 30s, 40s, 50s, we're maybe on the ground with kids or nieces and nephews. 60s, 70s, we stop getting on the ground, and we lose this ability. So you're going to sit on the ground, crisscross applesauce. You have to use your hands the least amount as possible. Okay? A couple different strategies to do this. If you see this thing, I'm not going to talk. Watch how I do it a couple times. Okay? Watch how I do it. See if you can incorporate some of these strategies. I'm going to not say a word, which is really hard for me a lot of the time. You guys know that by now. But I'm not going to say a word, and I'm just going to show you a couple different ways that I can get up. I'm going to keep my hands on my head so you guys can see that I'm not cheating by doing this. Okay? I'm going to stop talking and I'm just going to show you. Ready? That is one. Somebody is calling me. Okay, sorry for that. I don't know what, okay. Okay, this is what happens when we go live. I don't know what's going to happen. That was first strategy. Okay, we get back down. Okay, from here, I'm going to embarrass myself on this one. Ready? That's how most of your grandkids will do it. Okay? You get back down. From here. That's another one. That's difficult to do. Okay? See if your grandkids can do this one. I don't expect many of our moms and dads and grandparents to do this one. I have a hard time with this. I'm going 1 foot out. And getting up like that. Right? Couple different strategies. That was all no hands. The idea is to use the minimal amount of help as possible. Okay, so again, if you're from here and you can't go no hands, that's fine. If you need to go one hand, go one hand. Okay? Take it over to here. Like that. Okay? If you need to, you go 2 hands. There's a couple strategies there. From here. There's another one, right? There is no right or wrong way to do that. The most important thing is you try. You might try it today, and you look at me and you're like, Cal, what are you thinking? There's no way I can do that. Start where you are, use what you have, and get better. Right? Nobody expects you to be perfect, but it's a really simple strategy. Everybody has a floor, right? If you need furniture to get up on, then start near the furniture. But as you get better at it, right? Maybe today you're using 2 hands on the furniture. What's today, Friday? Maybe by Tuesday next week, you go 1 hand and 2 fingers on the furniture. And then by Friday of next week, you go 1 hand on the furniture. And you reduce the amount of help that you need so that your body does more of the work itself, right? And a lot of this is just training it. And I could go on a whole nother tangent about learning new skills as we age and how that helps us cognitively and how it helps us physically as well. So those are my 2 vital signs that your doctors forgot to tell you about. Funny enough, they tell us a lot more about the quality of life than a single heart rate reading would or a single blood pressure rating would. There are no medications that alter this. You could maybe make the argument some neurological ones would. But you're going to get an accurate reading on this, right? So those are the first 2. The other one that's interesting enough, and I don't think I would call it a vital sign, it would maybe fall into the category of getting up, is this ability to go from sitting to standing, right, from a regular chair. So I'm going to show you from my stool, but there's something we use in the physical therapy world called the 5 times sit to stand test. And it is exactly what it sounds like. You start a timer, you say stand up, sit down 5 times as fast as possible, ready to go. All right, and the patient stands up and sits down, stands up and sits down, stands up and sits down. We do it 5 times, we time them. If they fall into a certain category, it tells us what kind of risk they are to have a fall, what kind of quality of life they're projected to have. Very simple. Okay, so your first test is get up and down on the ground, no hands. Your second test is the 5 times sit to stand. Message me what your time is. Right? I want to know because I want to be able to help you if you need help. Okay? So 5 times sit to stand test. You need a stopwatch, you need a timer, you need something that's going to count seconds really accurately. Okay? You can use your hands if you need to. If you have like a walker or a cane, you can use that if you need to. The idea is we use less of those and we get better. Okay? But very simple, right? You could use the arms of the chair if your chair had arms. You could try not to. Ready? So we go as fast as possible, 5 times up, 5 times down. Ready, set, go. So we go up, down. 1, 2, 3, 4, 5. Stay down, stop the time. I can do it in 6.5. Right? I just turned 30. I should be able to do it in 6.5. I should probably be able to do it faster than that. But I'm going to show you guys my notes on my board here. Okay? But this is the age range. Oops, there we go. There we go. So if you are between 60 and 69, right, you're expected to do this in 11.4 seconds or less. If you fall in the 70 to 79 category, 12.6, 80 to 89, 14.8, right? So let's think about that for a second, right? Use your brain. If you're 60, okay, and you're expected to get this in 11.4 seconds, 19 years later, right, at 79, you're expected to go, what is that, 1.2 seconds slower? 19 years later, and that's all you're getting? Like, it's just a great, simple tool to show us where we are, right, and where we could be and where we are compared to other age norms, right? That's all this is. That's all this tells us, is from a generalized perspective on a very vast, different population, right? They look at men, women, comorbidities, no comorbidities, American, Canadian, European. They look Asian, everywhere. They look all over the place, and they figure out age norms is about this, right? It just gives you a starting point. If you're not there, don't worry about it. Try to get closer. Try to get closer. Try to get closer. The whole idea is if you are getting better every day, you're going to get closer to these numbers. You're going to improve your quality of life. I do not care how old you are. Everybody can still get better. So those are my notes. Walking is the functional vital sign. Right. Up off the ground is my other favorite vital sign. And then just a cool little test to kind of see and compare your age norms is what we use in PT as the 5 times sit to stand test. That shows generally, there's a lot of other things that we look at, and we should look at, we shouldn't just use one, to tell us what a person's projected potential quality of life would look like. So those are my strategies. Let me know either in the comments how you did getting up off the ground, or if you don't want anybody else to know, I totally respect it. Drop me a message and tell me, like, Kel, getting up off the ground is super hard or super easy, or I need to use this, or I could do it with one hand, or my grandkids could do it no problem. I think it's a really cool thing to run your whole family through, because it's going to show you how everybody's strength, how everybody's range of motion, how everybody's flexibility is, and it's just a fun kind of party trick that I like to use. So if you guys have any questions, write them in the comments section now. I'm here as a resource for you guys always. If you have something specific you want me to talk about next time we do this, I'm going on vacation next week, so you won't see me. Sorry. But the following week, that week of the 10th, I think it is, or the 11th, I will come back and I will do another Friday afternoon. Again, we got to find out a name. We got to figure out a name for this. Friday afternoon talks with Coach Kelly, Dr. Kelly, whatever. Most patients just call me Kelly, which is great. But any questions, let me know, guys. If you watch the replay, comment replay. Let me know how you did with this. If this was helpful, comment helpful. If you want me to keep doing these, comment helpful. And I'm happy to keep serving you guys in any way that I can. And enjoy the rest of the weekend, guys. All right? I appreciate you. Keep getting better every day.